Hi, Kevin Henry, the Group Editorial Director for UBM Medica's Dental Division, and I'm on a Google Hangout today with Colleen Huff. How are you today, Colleen?
I'm good, Kevin. How are you?
Doing well. I was wondering if you'd just take just a moment to introduce yourself to our viewers.
Sure. My name is Colleen Huff. I am a practice administrator, and also I've been in the dental field now going on almost 22 years. My background, I started at MetLife on the phones, spent 4 months in training with them, very formal. And then from there, my husband got transferred and I started working in the offices. Started managing it's almost 15 years now. And I also, about 2 years ago, developed 2 courses on insurance and to start speaking and training on it. Do a lot of research and attend a lot of seminars and whatever I can find to keep myself up to date. And the biggest one that's been a challenge and a learning experience was the Affordable Care Act itself.
Well, and hey, that's why we're talking today. So great lead in and great timing. So tell me a little bit from your experience how you've seen that the Affordable Care Act has changed how dental practices operate.
I think the operation is just starting to happen in the practices. It's been, for about the first 2 years, I watched the offices, myself included, kind of bury our heads and try to ignore it from even affecting us. But what's happening now is more of the companies are coming into it, the employers, and it's not going to go away. So the offices are having to try to adapt to that. So there's more education that has to happen. There's more patients calling with the Affordable Care Act plans, and so there's a lot of confusion happening.
So has that been the biggest impact that you've seen about the Affordable Care Act, or is there something else?
Well, I also think it's starting to show there's more patients out there with coverage. And so with that, there's a shift that's going to happen. And I think you're going to see offices willing to learn about it and offices that aren't. And it's going to affect the bottom line for a lot of those practices.
So let's talk about maybe some of the biggest mistakes that you've seen dental practices make when it comes to the ACA. What are some of those?
Some of the biggest mistakes they're making is that they're ignoring it. As the plans moved into the market, into the employers themselves having the coverage, or as I want to call it, there's an illusion of coverage. So there's a lot of people out there that think that they have coverage, and because the offices haven't educated themselves, they don't realize the type of coverage it is, how it works, what they have to do. So what's happening is, and it happened to me the other day, I had a phone call, and if I hadn't educated myself and learned how many different plans are out there now, I would have seen a patient that I can't see. A lot of these plans have no out-of-network benefits, and in the dental field, we're used to in-network and out-of-network, and not really having that as an issue. And even the traditional regular dental insurances are starting to move into what they're now calling an EPO, which you have to go to a provider that's in that PPO network. The Affordable Care Act has a lot of plans that you have to go in network or they pay nothing. So the mistake I'm seeing is offices think, well, I don't have to learn it. The patient needs to know it on their own. And so they're either seeing patients and then getting nothing paid. So now you have a patient yelling and screaming at you, or they're saying no to patients they might be able to see, but they haven't learned it. So I think the lack of education or the thought that I don't participate, I don't have to learn it, to me is the mistake that a lot of insurance coordinators and managers are starting to make. And they're going to feel that impact in the next year or two.
And really, it's the front desk that kind of gets the brunt of all this, right?
Oh, yeah. And it's making it hard. When the Affordable Care Act first came out, it was strictly through the marketplace. So it was one simple question. Patient called up, I have insurance, do you take it? So I added to my, we all have to spend some time investigating what it is, but I added to my repertoire of questions, where did you purchase it? Or is it through your employer? But 2 years ago, that question became null and void because now the employers are offering them too. So it's becoming harder for the front to determine where the plan is generating from and what type of plan it is. And the other thing that's happening is patients don't know they have coverage in a lot of cases. there's embedded dental plans that they didn't read their book, and so they don't even know. And I had a case that I used in my webinar that I did recently and in my seminar, that the patient's regular dental insurance was Delta, and then they had an embedded plan that Delta processed internally, and the patient had no idea they had the coverage.
Wow. And I know it's a stunner for a lot of our viewers to think that patients don't know their insurance. I'm sure everybody's stunned about that. So,
well, yeah, well, and because the Affordable Care Act made it that children are now have to be covered, and the employer is under an obligation, anybody 50 employees or over has to offer something, that you're seeing a lot of embedded plans, and people aren't paying attention to what they have.
So what's the one thing, if a dental practice is watching this and they walk away, what's the one thing that you want them to know and maybe even implement whenever it comes to the ACA?
Go to your local marketplace and learn what plans are offered in your area. You need to familiarize yourself with the names of the plans, the types of plans, and who they're being offered to. Most of the marketplace have a map almost of some sort. They're all a little different, but most of them have a map to tell you what's in your county. And then from there, you can break it down to what's offered individual or what's offered as an employer, small businesses, and soon it's going to add large businesses this next year. The small business practices are being offered a lot through the marketplace, and my understanding is the bigger companies are going to start having to list that also. So like the webinar that I gave, or if anybody wants to email me or find out some information, I can help, send them to the right spot. I spent some time going into all of the states and figuring out where you go to. And then from there, you have to determine. I think that's the biggest thing they have to do, because even if you have that list, you know what to ask. And, I had one recently that it was MetLife. So, well, we're par with MetLife. Great. Except for it was a MetLife Affordable Care Act plan that has no out-of-network benefits, and you have to sign on special. And that's actually another point, too. There's a lot of offices that maybe took Medicaid or the state plans, and they assumed they're signed on to these Affordable Care Act plans, but most of them are a separate contract. And not everybody realizes that either.
So I know you talked about if people wanted to reach out to you, how would be the best way to do that?
Well, I do have a website right now. It's kind of being worked on, and it's dentalinsurancelady.weebly.com. Or they could email me at dentalinsurancelady@gmail.com if they'd like.
So Colleen, thanks so much for your time today and your expertise. I really appreciate it.
Thanks, Kevin. This was a lot of fun.